Brilliant. Welcome, everyone. I'm seeing the participants joining, a few at the moment, so I won't get stuck in too much, but just to say welcome. If you're here for the Becoming a Doctor session, you are in the right place. And we will be kicking off with a fantastic selection of doctors in different roles shortly. My name is Jack. I am the moderator from Middlesex, and I'll be facilitating this discussion. Brilliant. We've got just over 40 people joined, so I think we will kind of get started. So welcome everyone to the session, Becoming a Doctor. Labeled All You Need to Know. I'm not sure about that, but we'll try and get as much information across as we can. My name is Jack from Middlesex University, and the purpose of this careers panel is to give you some insight into the breadth of roles that kind of fall under the word doctor within the NHS by meeting some really interesting individuals. So we'll be meeting a group of doctors from different specialisms throughout. If you wish to ask any of our panelists a question, please use the Q&A function on your screen. And we will have some time at the very end for Q&A. In the meantime, we'll be going through some questions that have already been submitted, and thank you for those if you submitted one. What I'd like to do is I'd like to call the panelists to kind of introduce themselves and tell us a little bit about the journey into their current career. So if I could ask Dr. Okorafor to begin, followed by Dr. Jacobs, and then by Dr. Singh.
All right, fantastic. Hello, everyone. It's kind of weird doing this by Zoom because I can't actually see you, but I hope you get a good flavor for what it is that I do. So I am a pediatric doctor. So essentially that means that I work with children, and that's any from literally newborns right the way through to about 18. And I absolutely love my job. There's not a single day that is the same. And the flexibility and the breadth of what we do is just tremendous. Right? So I've always wanted to be a doctor, wasn't quite sure what I wanted to be. And that's the great thing. You go through med school, 5 or 6 years. I went to Imperial College, and you go through various placements, getting a real flavor and inspiration from different doctors. Some doctors made me think I definitely don't want to do what he or she does, but you get to see a real host of things. And I loved science. I loved how the human body worked. There's so much scope within medicine. And so you do five years. And some of it's clinical, some of it's lectures. I love the practical side of things. You then do 2 years as a foundation doctor, and you can do a host of different specialties, orthopedics, A&E, GP, renal medicine, pediatric surgery. I did obstetrics and gynecology, I did GP, I did pediatric surgery, A&E, and you do those over the course of the 2 years so that you can get a good exposure to different parts of medicine, different things that you wanted to do. But I knew quite early on that I love working with children, I love working with their families, and so then I'm on the route pediatrics. And so to become a pediatric consultant, it's then a further 7 years, but that whole time you are learning as you're training and being paid as well, obviously, right from coming out from university. And so I find it absolutely fantastic what I do. So this is a kind of word cloud of all the different specialties. I'm hoping I'm not going to offend any of the other doctors on our panel, but right in the middle is us, the pediatrician, the words when people thought, how would you describe those people, those specialties? Friendly, fun, caring, smiley. You can see a little bit tired. We do shifts, we do night shifts, day shifts, weekend shifts, all sorts. And you can get, once you're a consultant, you get called in from home. But it's really exciting. Absolutely. So at the moment, I work over in North Middlesex Hospital. I don't know if any of you have been there, but I work in A&E. I also work out in the community for a job that was essentially created for me because I'm overly enthusiastic and they probably wanted to get rid of me. But we've set up an organization doing pediatric community outreach. So I go out in the community teaching parents basic life support, child health, keeping their child healthy. And I've just come off a course today, and it's so rewarding. Like, as I say, no 2 days are the same. I can be in A&E with a child with a broken leg, with someone who's stopped breathing, with just snotty nose, someone who's sadly self-harmed. No days are the same. And really, the teamwork within pediatrics is huge. So various specialties, even within pediatrics. So once you're a doctor, you can become a generalist, you can branch off into different specialties, orthopedics, renal medicine, neurology, a whole host. But once you're in pediatrics and you decide, actually, I prefer children, I prefer smaller people. Even within pediatrics, you've got mental health, pharmacology, community child health, gastroenterology, so that's all your bowels and things, nutrition, allergy, intensive care, and neurology, neurodisability. So there's still so much that you can do within pediatrics. And oh yeah, there are even more. I won't go through all of those. There's a big host. I think that's actually one of my little ones. And so yeah, what we do, looking at X-rays, that was a fidget spinner there that got stuck in a child's throat. That's actually one of my kiddies with her snotty tonsils out. And yeah, we deal with young people as well, and sort of the difficult mental illnesses that sometimes they suffer with. And so yeah, real passion for pediatrics. Do what you love, will love what you do. We're real hardworking team players, caring, resilient, and I think that goes for most doctors, but certainly within pediatrics, it is hard work, and you do have to enjoy what you do. And there are lots of options. That's one of our consultants who works over in Uganda. You get a good work-life balance. A lot of our workforce are women, and even if you're not, there is now an understanding that actually you've got to live life at the same time. And so I work part-time, 3.5 days a week, which means I get to do all other things and have a family. And so we work hard, we do play hard. And there is a real teamwork is absolutely everything. After night shifts, we often have breakfast together. Now it's all very much socially distanced, which is a little bit annoying, but I'm hoping we get back to some life. So yeah, medicine, very rewarding.
Thank you, Dr. Okorafor. And yeah, after a really, really impassioned start, we'll be moving on to Dr. Jacobs, who will also talk about pediatrics. Just to say, because I know Dr. Withers has joined us, you'll be going fourth, if that's okay, after Dr. Singh, and welcome to our careers panel. Over to you, Dr. Jacobs.
Thank you so much. And Jack, I've had some technical problems, so if there's a problem, please let me know, but I can see you and hear you nicely now. And I really enjoyed listening to what Akudo just said. And I have to say, I agree with every single word she said. My job, I would say, is quite similar, and my impressions of my job and my career are similar. I hope I don't offend anybody by saying I suspect I'm a lot older than Akudo. I qualified for medical school in 1985, which I suspect maybe before a lot of you guys were born. And I've had a great time since then, almost 40 years now of being a doctor. I've worked around the world. I've worked in many different jobs. As Akudo says, there's enormous scope. There's no 2 days that are the same, and there's no 2 doctors that are the same. But for me, going to medical school and becoming a doctor opened up many doors and has allowed me to do many things. I'll tell you about a couple of them very briefly. But first, I just want to perhaps slightly disagree with just one thing that, Jack, you implied when you said there's all these doctors and a whole range of things within the NHS. I want to say that there's a lot more even beyond the NHS. So most doctors in this country will work in the NHS, and I certainly do the majority of my work, the vast majority of my work in the NHS. But there are doctors who work outside the NHS. For instance, you can work for university. And again, I suspect Akudo has done research and so on. And I think you'll probably hear from other doctors this evening about what we call academic work. You don't necessarily have to look after any patient. You can work in a lab doing research. And now with COVID, we're seeing various doctors who've become quite famous. They don't do the sort of work that Akudo and I do. You can work for industry, designing vaccines and finding the cure for cancer. You can do all sorts of amazing things. My passion is very similar to Akudo, though. I am a children's doctor, a pediatrician. I work mainly in Stanmore at the Royal National Orthopaedic Hospital, which specializes in bone problems. Not many people know this, but the word orthopedic doesn't actually mean bone. It means straight child, because ped means child, and that's why Akudo and I are pediatricians. We're children's doctors, and orthopedics was invented to help children who are not straight, to make them straight. And I work here at the orthopedic hospital, see children from around the country with, some of them have very rare bone problems, and I work with amazing colleagues. I think one thing that I'm sure Akudo would have said, but I didn't hear her say, I'm sure she would agree, that our job is often very much teamwork. So people like Akudo and I work very closely with other doctors and with all sorts of other experts, nurses, therapists. And for me, that's one of the great joys of the job. I suspect my time may be up, and I know there's going to be time for questions and so on. So, Jack, should I leave it at that and say thank you for having me?
That's great, Dr. Jacobs. Yeah, we're definitely coming back to you. So don't fret. Over to you, Dr. Singh.
Hi everyone. Yeah, so I'm slightly different to the other two doctors. I'm an anaesthetist by trade, and quite possibly, you know, we're not part of the sort of larger field of sort of normal doctors as such. We tend to, as probably shown by that sort of that slide by Akudo, which showed certain characteristics about us, is that we are sort of in the background, a little bit more relaxed, a little bit more chilled. I definitely agree with that, 100%. But in essence, I think anesthesia is basically the physiology of the body. And I think that's what really kind of attracted me to do anesthesia. And in essence, I think if you were to sort of describe what we do or what I do on a daily basis, it's, well, obviously anesthesia, the first thing you think about is sort of putting patients to sleep for surgery. That's of course one of our jobs, but around that becomes, there's so many things. So we basically deal with the critically ill patients. And I think what this COVID-19 sort of pandemic has shown is that you know, dealing with those critically ill patients and being able to be calm and relaxed in those very, very sort of difficult situations is key to being an anaesthetist. This COVID-19 really has brought to fore this kind of the intensive care. And generally talking, you know, the intensive cares that we normally work in are normally run by anaesthetists. So we, apart from just, you know, doing the surgery and doing the anesthesia for surgery, we tend to sort of deal with patients in intensive care. But also we have a secondary sort of field. We deal with all the critical emergency admissions to hospitals. So we attend A&E. So we work with pediatricians, dealing with those very, very sick kids who come in. And we look after them and we deal with their problems, possibly by making sure they put onto a ventilator appropriately and looking after them in our very specialized secure units. The essence of why I think anesthesia, it's basically whenever, the real thing that attracted me, and I have to say this, is that whenever I did all my training, as Akudo mentioned, you do all your medicine training, undergraduate training, and then you do your training as a doctor. When anything went wrong, and when any other patient was really coming into a bit of a sticky situation, or there was a patient who was very sick, everybody looked for the anaesthetist. Everybody waited for the anaesthetist to come to deal with this situation. And I think it was that sort of attraction of dealing with those really ill patients that really attracted me to doing anesthesia. With anesthesia, there are so many different components to it. I actually now sort of specialize in chronic pain sort of issues. So in essence, we deal with chronic issues of like basically back pain, knee pains, and all those kind of arthritic pains that we all probably will get eventually. And so now I hold clinics and we hold procedures and we do operations ourselves as to try and deal with these problems. But yeah, it is basically the love of physiology and the way the body works which really attracts me to anesthesia.
Thank you, Dr. Singh. Appreciate that. And then if I could move on to Dr. Withers to explain a bit more about her and her role, that would be fantastic.
Hi everyone, I'm Leah Withers. I am a GP. I actually qualified about 7 months ago, so I'm quite new. I'll talk about general practice in a minute, but you probably have all, met your GP, even if it's, quite a few years ago now. And so you're probably a little bit familiar with what we do day to day. But if you're thinking about being a doctor, I suppose you're probably wondering about what the pathway might be, or how to, go about your applications and things. So I can remember, thinking thoughts like this myself about 10 years ago. Wondering about what makes a good doctor. Would I enjoy being a doctor? And I think some of the things that people often find in a career in medicine is that it's actually quite a worthwhile and fulfilling career. You got to meet a lot of really interesting people every day. If you enjoy a bit of science and problem solving, it can make it really interesting for you. Once you get into medical school, you then all of us have done 5 years at medical school. And then after that, you take your first job as a doctor and you spend 2 years working as a junior doctor, doing lots of different specialities, and often working in different hospitals. And then after that, you can choose which career you want to do, be it, pediatrics like the others, or anesthetics, general practice. And then after that, you do some training in that particular area. So that's the sort of the pathway, the journey to becoming a fully qualified doctor. And, at your stage, you might be thinking, what do I need to do now to become a doctor? And have a look at, if you're thinking about certain universities, have a look at which A levels they request. But usually they need you to do chemistry A level, and sometimes some other science A levels. And then medicine, it can be a little bit competitive. So it's not just about the academics, it's also a little bit about making sure that you as a person want to do medicine. So sometimes that's, like for me, I found by shadowing doctors in hospital, doing work experience, you can just find out what actually being a doctor is like day to day. And then a lot of people find that if they get a job as a healthcare assistant, it can help them find out if this is the kind of thing that they might be interested in doing, looking after people, caring for people longer term. So I do general practice, quite a lovely speciality. It's quite easy to work part-time. You get to meet lots of people every day, and you get to meet them over and over again. So we talk to people every day about, simple things like blood pressure, or it might be that they're having chest pain and they're worried they're having a heart attack. They might be depressed. So we see absolutely anything and everything. And one of the things I really love about it is that you meet people when they're having, horrible crises, or they've just lost a loved one, and you see them through that crisis and out the other side, and you get to meet their families, their grandparents, their grandchildren. It's a really lovely and very rewarding speciality. Yeah, I think that's it for me.
Thank you. That was great. There's a few things I'd love to touch back on. But before we do, I just want to move on to Dr. Rashid, who's joined us, and apologies for any Zoom link problems in the virtual world. But thank you for joining us. Love to hear from you. We've kind of offered all of our doctors 2 or 3 minutes just to really briefly explain them and their role. If you could do that before we move on to. We've got quite a few panelist questions actually, or questions for you guys. So over to you, Dr. Rashid.
Thank you so much. My name is Maria Rashid, and like Dr. Withers, actually, I am on my way to becoming a GP. So she's a fully fledged GP. I am just slightly behind that, on the same pathway. And actually my path has been very similar. So I think she's very beautifully, as has our colleagues, very beautifully explained the things that you need to become a doctor and, you know, to join our career path. And that obviously is A levels. I know obviously the main ones that they ask for is sciences, but it's useful to have something else as well. Do something that you enjoy, because then that will carry you through for the rest of your path and your career as well. When you look for careers as well, for medicine in particular, when they look at your application, they look for sciences, they look for, you know, that you're an intelligent student, and you are an intelligent student, you're bright, you have lots of potential, but see what else, you know, makes you original, makes you unique, and do things that you enjoy, because you'll be surprised when you're working in a busy hospital, in a busy GP, whether it be anywhere else in the science, you know, arena, those extra skills, you know, they make you stand out, and they let you kind of mix and, you know, connect with other people, because at the end of the day, it is a very large team. Becoming a doctor and working in healthcare sector, we all have the same goals, and you need to be able to work with other people. So I'm not going to talk about the qualifications because I know my colleagues have talked about it, but myself as a GP trainee, just want to reiterate that, yes, I look after everything. So I'm a generalist. I will look after you from head to toe. I will look after you from day one all the way to day 100 if you are lucky, okay? So I will be there through your best times, through your worst times, but those are probably one of the most rewarding moments in life. And I can certainly say from my personal experience, some of the most rewarding moments have been when you think all is lost, you give it your all, and actually you've managed to pull someone back from some of the worst moments, and you're both there and you're like, what a relief. So they're really sort of high impact moments, and I'm not sure you get that in any other career, being able to make that personal connection with someone that you didn't really know 2 minutes ago, and suddenly you have that really close relationship, you're making a really big impact, and you suddenly feel that this is probably the most rewarding career ever. So I would definitely welcome you all on board, and I would say bring all the skill, you know, as wacky as or as eccentric as it is, because it makes this healthcare system, that's what we thrive on essentially, and that's what makes a really good team.
Thank you so much. Appreciate that, Mario. That's really, really great. And thank you everyone for your amazing introductions. And I think already you've given people a taste of some of the questions that they've actually asked. I'm actually going to dive straight into some of the questions that have been asked in this panel, but maybe pause some of the questions I was originally going to ask. Just as a bit of a heads up, I'm going to pose a question to one person at a time. If you do have something you really want to throw in, please do after that. But if not, I've got plenty of questions to get through. So just as a heads up, I will be kind of calling on everyone. First question for Dr. Okorafor. It was actually a question that's just been submitted, and it's around how do you manage your emotions as you are dealing with poorly and sick children?
Oh, that's a fantastic question. Yeah, so we can be in A&E, sitting there just relaxing, it happens, on a quiet shift, and it's often sort of 4 a.m. suddenly you'll get a call, and it will be a blue call. They'll say that a child's not breathing and they're doing CPR or something like that, and then the paramedics come in. You know, at that point everyone switches into this is what we need to do mode. Okay, so then you're leading a resuscitation and you know what needs to happen. The nurses are there, and exactly as Dr. Singh said, it is a team effort. The anaesthetist being there always makes me feel a lot better, but it's often when the parents come in and you can see the sheer, and I've got 5 kids myself, you know how scared that parent is right now. Their child's life is essentially often in your hands, and so that means that you have to put aside your emotions for that time as much as you can do, because there have been some real sort of tragedies, even sort of parents that have harmed their children, and so in those instances when you're almost feeling anger as well, to be in that sort of situation with the child in front of you. But we know that we've got a job to do. You focus, you do your absolute best, and then afterwards we always debrief as a team. We always will talk about what went well, what could have been done differently, but all the while, the care of the family, not just the child there, but the family that has come with them is your priority. And so you do afterwards. We are a big team, and we are always there for our colleagues. And so I will, after debriefing with my colleagues, I will then give them a ring at the end, like after their night shift. I will then check in with them later, especially the ones that are more junior to me. But we bring ourselves through, and I think that's the one thing in COVID, realizing how fantastic the teamwork is throughout the hospital. Everyone just came together for each other and supported each other.
Thank you, Dr. Okorafor. I really appreciate that. One of the things I wanted to pick up with Dr. Withers, and this was just around opportunities. What opportunities are there for kind of newly qualified GPs? And I guess linked to that, or someone has linked to that, how hard is it to find a job, as a GP?
So usually it's not that hard to find a job as a GP. During COVID, that has changed a little bit, but I'm sure it will change back again. And there's so many opportunities, it's almost overwhelming as a newly qualified GP. I think it's quite useful in the first few years just to focus on general practice and get really good at trying to figure out everything about it. But there's loads of opportunities. So I do a bit of teaching once a week for medical students, but you can decide and branch out into numerous different things like, medical journalism, or you could be a school doctor, you can have a special interest in bones and joints, or all kinds of things, and you can develop that special skill and interest and then just do that part-time alongside general practice. So it's one of the really lucky things about general practice, is that you can almost make it into your very own dream job, because you don't do the same thing every day. You can choose what you do, and then you can change what you do halfway through your career. It's really easy to just make it into whatever you want.
Thank you.
I think I'll just add to that. I mean, I got a lot of GP friends who have actually gone into like sports medicine and stuff like that, and they find that very, very interesting, particularly with football and everything. But most of the sort of the doctors who cover these football teams and stuff like that, they're normally GPs who have specialised in their that sort of speciality. There's so many things to do as a GP, and you can specialize in all these various things. It's really, really gives you lots and lots of opportunities.
Thank you, Dr. Singh. Appreciate that. And specialisms have come up a few times, so I may come back to that. Just talking a little bit about, I've had another question on pediatrics, so I might go to you, Dr. Jacobs. And there's a question on how you become a general pediatrician who just works with ill children in hospitals, so not necessarily specializing in a certain type of pediatric medicine.
Yeah, so in pediatrics, even to be what we call a general pediatrician without any subspecialty, it's still, as you heard from Akudo, it's still a long training. You have to do the 5 years in medical school, and then at least another 7 years pediatric training to be what we call a general pediatrician. I actually took an even longer route. I did all that, and then I did 3 years in Toronto, also in what we called general pediatrics. And I think that's because general pediatrics is a bit like what Leatrice and Maria were saying about being a GP. A GP has to treat almost anything, and general pediatricians also. We only deal with children. I go up to the age of 18 years, but a lot of our work is dealing with premature babies who are like minus 3 months of age. They were born very early, they're tiny. That's a whole field in its own. So pediatrics is a wide field, and to be a general pediatrician, there's a great training, but I wouldn't worry about it. You get paid all the way through, and it's great fun.
Thank you, Dr. Jacobs, appreciate that. I wanted to kind of come back to experience, and Mario, I wonder if as a trainee GP, so most recently, experience going through that, if you could add anything around experience worth getting before applying to kind of medical school.
So I think all the experience that I think we all can think of, and that almost automatically jumps to the front of our minds, is getting some experience in maybe a healthcare sector. So that would be either in the GP or either in a hospital setting. But I appreciate that with COVID, that's really difficult to do. Even outside of COVID, particularly if you don't have access to those kind of things readily, they're still very, very difficult to get. But I would spread out, I would expand out, and actually there's lots of healthcare facilities and areas as well. And I know today that's what the whole day's been about. So you've got pharmacy that works very closely with GP. They are more than happy to have you in their pharmacy. You can see how the people, how to communicate with people. You get that experience of treating illnesses, treating people, speaking with the GP and interacting with them as well. Also within the hospitals as well, sometimes they will have like an open day as well, and that way you can attend that and you can see the inner workings of a hospital and the different departments as well. You can write to the hospital work experience departments. A lot of them in the human resources will have their own area that deals with the requests for work experience, so you can get in touch with them as well, and then think about sort of non-healthcare things as well, because there's certain skills that you can find elsewhere. And like we were saying before, it's about communication. It's about sort of being able to talk to someone, and someone, even when they're not happy, how would you deal with that? And that you can get outside of healthcare. It doesn't have to be in healthcare. People do a lot of part-time jobs and they find that actually working in customer services has that same experience, has that same interaction that serves them well, and actually looks quite good on your application as well. So I would explore all those avenues. I would not actually put any experience, unless it's way far off, and it has, you're not going to gain any kind of crucial skill, like communication or working in a team or managing, several tasks, taking on responsibilities, because those are things that you want to demonstrate through all of this experience. The experience is not to make you a fully fledged doctor. That will happen on the training and as the degree. The experience is to show you insights of what the career is like and to see whether you have the skills to be able to become that final product. So there's lots of options on there. And I think the NHS careers option is a brilliant place to start, because it tells you all the other areas that you can actually apply to, explore, contact directly and say, look, can I come to your department for a couple of days? Can I, or even during COVID, can I sit in on a couple of meetings and listen in and see how, this team works and how it's set up? Because I know so much is going on remotely at the moment, but lots of places have taster days as well. So it's worth contacting them individually and seeing whether that's something you can join.
Thank you for that. That was brilliant and really, really appreciated. And I wonder, Dr. Singh, we were speaking actually before this talk about grades and there being a kind of cutoff to kind of accessing courses as a doctor, and quite a few people, as well as expressing their concerns about getting work experience, which I think you've touched on, Maria, due to COVID, they've also expressed concerns about getting the right grades. And I wondered if you could perhaps touch on maybe other pathways into becoming a doctor, and just any other thoughts you have on students who do have that fear about their grades when they're trying to enter.
Yeah, I mean, I have a specific viewpoint on this. I mean, there is, I think the demand, the grades are sort of determined by the demand, and clearly there is quite a significant demand for doctors currently. And there's a lot of people currently who want to do it. So therefore, and particularly because of the type of work that we do, it does require a degree of, I'm going to be very blatant about it, a degree of intelligence. Of course, it does. But I think what's important to mention about it is that, as Maria basically mentioned, there is a degree with which communication and your ability to deal with issues all at once and being able to take responsibility. I think these things are, unfortunately, currently, with the way things are not really taken into account when it comes down to getting the right grades to get into university. Well, clearly there are more and more places opening up with regards to possibility, with different universities opening up. I think obviously in Plymouth there's a new one that starts up, but in particular what we have seen is that there are people who then convert eventually from a base speciality to medicine at a later date. And for example, not to mention one specific place, but the one I know that St George's Hospital down in South London, they particularly specialize in people who have done other base specialities, particularly biochemistry, and other science subjects. People who have done that as their base sort of degree then obviously have the option to convert to medicine. So there are those options, and I know of quite a number of people that I've worked with. In particular, one person in actual fact did law and then converted over to medicine and was fantastic. Just had the real kind of acute eye on things and really was able to sort of take problems and look at problems from a different perspective. So the straight sort of way of getting the right grades and then progressing into your normal traditional university, I think that's expanding a little bit. I think there are now opening up to this different ways with more university places, but also the possibility, yes, of course, of doing one other base speciality, be it a basic science type degree, and then converting over. So I'd like to see that. I think everybody on this panel would agree that getting A stars is not the way to become a doctor. The basic principles of becoming a good doctor is being able to communicate, deal with problems, lateral thinking, and that sort of thing. That's what really makes the good doctors.
Thank you so much, Dr. Singh. And I think that has resonated with everyone. Just moving on to Dr. Okorafor, because I think something you said struck me about the 24/7 nature, and I'm sure that's across all of the roles, not just pediatrics. But questions have come in around how you manage your sleep schedule as you change between day and night shift. And I thought you might, kind of weigh in on that.
So I think I've always been kind of nocturnal. Anyone who knows me, like yesterday, I didn't actually sleep, but I and my other half is a police officer, and so we're both very much used to switching our shifts. And so people have got different strategies to doing that. I enjoy it. I like the complete variety that in terms of your sort of the day-to-day pediatrics and dealing with kind of other teams, to the nighttime more emergency based, and our roles are pretty flexible in terms of you don't get completely flogged. You're not like doing runs of 7 night shifts or whatever, and like a zombie on the shop floor in A&E or on the wards. And so it is very much so. At the moment, I've just submitted all my hours that I want to do between June and September. So I've got a self-rostered rota, which means I basically choose when I want to work, which means that I can get to all the different other things that I need to for my children. And when lockdown opens up and we have some freedom, I kept nice chunks open for socializing, forgotten what that is, but yes, being able to be flexible and swap shifts with your colleagues, you just manage it.
Thank you. And I think socializing and that is a dream for I think many people. So we look forward to that. I wonder if I could touch with you, Dr. Jacobs. One of the questions that's kind of come forward has been if there's any expectations you had about your career path that you'd found differed to reality.
Well, so when I started out, I didn't think I would be where I am now. So I guess in a way the answer is yes, but I also expected it to develop, and I'm sure that over the next 40 years, you guys, if you do go for medicine and you go to medical school, you can be sure that when you start medical school, you'll be learning stuff that will have changed by the time you've left medical school. Science is progressing so fast that the things I was taught in medical school are not really relevant nowadays. Some of them were wrong, some of them are just not relevant, and I didn't know which way my career was going to take me, but it has taken me where I wanted it to. I enjoy going to work every day. I look forward to my work. I do have some time off, which I need, and I enjoy my holidays as well. But basically, the career has given me what I hoped, and it's been very rewarding.
Thank you, Dr. Jacobs. Really, really appreciate that. I had another question about preparing for medical school exams. I don't know if anyone would like to kind of weigh in on that.
Sorry, I was just going to ask, was there a specific area that the question was relating to?
I mean, one question asked about the experiences with the acceptance exams, UCAT, BMAT, and another question was around how you prepare for the UCAT. That's the context.
So for myself, I sat both the UK CAT and the BMAT exam. They're slightly different exams, and they test slightly different areas of thinking. The BMAT has it has almost equal emphasis on your sciences that you would have already learned in your A levels, as well as your sort of written English skills as well. Whereas the UK CAT, when I sat it, certainly, I'm not sure whether it's changed, but it was very much a situational judgment test, and also tested other areas like decision making, pattern recognition. For both exams, the preparation is slightly different. For the BMAT, it's very much traditional, so you'll need to make sure that you have got a good grasp of your sciences, of your written English, and sometimes it's worth sitting with your careers advisor or your teacher that kind of knows you quite well, and just going through some of the questions with them and for them reviewing your work. Now, with the UK CAT, that's slightly different. First of all, there is obviously technique of sitting that exam, being aware of what type of, what the areas it's testing. And there is also a knack in that the more questions you see, the quicker you recognize what it is asking, the patterns, and then being able to make a decision, or if it's a situation in judgment, then being able to decide what is the appropriate response to a particular situation. For both of the exams, I would recommend speaking to actually a careers advisor or someone who's really sort of well versed in preparing people for that exam, because that extra insight definitely helps.
Great. Thank you so much, Mary. I really appreciate you weighing in on that. As you can see, it's 1:55, and while we have a couple of minutes of flex, although obviously some of the doctors may not. There are sessions beginning at 5 past, so I think that's important to flag for students who wish to attend nursing session, career in therapy and allied health professions, or the radiology and radiography, which start at 6:05, and can be accessed on your schedule. If you're happy to, you're welcome to stay online for another minute or two. I guess the final question I wanted to approach, and I'm happy to hear a really brief bit from everyone if they wanted to weigh in on this, was just around that final choice in making your specialism. As we kind of discussed, we've gone back and forth on how there are so many different specialisms. And like I said, it needs to be fairly brief from anyone, but everyone is welcome to weigh in on this. How do you make that final choice on what you would like to choose to specialize in? Anyone wish to start?
I can basically say that without going on a bit, it was anesthesia, as I probably mentioned, was a good kind of combination of dealing with like very difficult situations and critically ill patients, and trying to sort of, let's say, when we were called to deal with an issue, then we kind of understood that it was something that was critical, and I think it was that ability to deal with things under pressure. And I think being able to sort of feel that confidence inside you to be able to deal with that situation, I think that really I found very attractive. And I think that's what really kind of like drove me to become an anaesthetist. And I think, if you are that sort of person who does thrive under pressure and who is able to sort of, while everybody else may well be sort of a little bit kind of dilly-dallying, and I'm not going to say that about other people or other doctors, but just in a situation, then maybe anesthesia might be for you.
Amazing, thank you. Anyone else want to weigh in on this? And before they do, just to remind everyone, they will be getting a recording of this session, which is great. Anyone else want to weigh in on that? You know, how do you make that final choice on a specialism?
So for Dr. Singh, definitely anaesthetists are like our heroes. And so if you want to earn your cape, absolutely. So for me with pediatrics, as I sort of said, dealing anything from newborns, and they might be premature 500-gram newborns and having to put a tube in. That's where I get to sort of be the hero, like Dr. Singh, putting in that tube to help inflate that baby's lungs for the first time, right the way through to seeing a child in or a young person in so much distress that they've wanted to take their own life. We can do such a broad range, but knowing that people only come to see us for help. And so being able to, which is right the way across medicine, essentially, being able to be there and be that person that helps them is fantastic. And so I go home each night and my children will ask me, what did you do today? And being able to say different things, and it's quite great. They think I'm awesome. I'm not usually day to day, but yeah. Very rewarding.
Thank you. We've kind of, I'm afraid, come to the end of our time, but I think you hit a note that probably resonates with all of our doctors here, and probably everyone on this session, that you know, the role that all of the doctors and other healthcare professionals are doing across the country and other frontline workers is awesome. And hopefully this session has been really useful for those students, almost 60 students watching this session. Has been that. So thank you very much to all of our panelists. Really appreciate you giving your time up for this session.
Jack?
Yes.
Okay. Sorry to interrupt, but could you launch the poll for me, please? Do you want me to launch the poll? Hi guys, we're going to launch a poll now. We would just ask you to give answer the questions on there, please. It is anonymous. Thank you. Thank you, Nat. Appreciate that. Yes, please answer the poll. That will help us make these events even better. But yeah, thank you so much to all of your panelists for feeding in on that.
Good luck to everyone. Be great to work with some of them one day.
Thank you for supporting today.
Yeah, no, thank you so much. And recordings will be available. Both they'll be sent to everyone who attended the session and everyone who didn't. But also they'll be live on YouTube. So panelists as well, if you wish to see yourself back in action, we're happy to share those links with you.
Brilliant. I'm just waiting for a few more people to complete the poll.
Amazing, thank you.
Are we done?
Yes, panelists, if you wish to leave, you're very welcome. You guys have given up loads of time already, so thank you so much.
Thank you so much.
Thank you. Bye.
Bye.
Thank you and all the best. Best of luck.
Thank you.
Bye.
I'm just going to end it now, Jack.
Thank you.
Okay, thank you. Bye.
Bye.
Thanks for joining.